Hello, my fellow viewers! Today we're going to delve into a topic, the intriguing journey of pregnancy, specifically focusing on the first trimester. So sit back, relax, and let's embark on this amazing journey. The first trimester of pregnancy is a critical period for the development of the baby, encompassing the first 12 weeks. Here's a detailed description of how the baby is formed during this stage. Weeks 1 to 4, conception and early development. 1. Fertilization. Pregnancy begins with the fertilization of an egg by a sperm, which typically occurs in the fallopian tube. The resulting zygote starts dividing rapidly while traveling towards the uterus. 2. Blastocyst formation. Around 5 days after fertilization, the zygote becomes a blastocyst, a ball of cells with a fluid-filled cavity. The outer cells will form the placenta, while the inner cell mass will become the embryo. 3. Implantation. About 6 to 10 days after conception, the blastocyst implants itself into the uterine lining, endometrium. This process is crucial for establishing the pregnancy. Weeks 5 to 8, embryonic stage. 1. Development of the embryo. The embryo is now formed and starts developing rapidly. The inner cell mass differentiates into 3 layers: the ectoderm, mesoderm, and endoderm, which will give rise to all the baby's organs and tissues. Ectoderm becomes the nervous system, skin, and hair. Mesoderm forms the heart, muscles, bones, and blood. Endoderm develops into the digestive system, lungs, and other internal organs. 2. Neural tube formation. By week 6, the neural tube, which becomes the brain and spinal cord, begins to form. 3. Heart development. The heart starts to form and will begin beating by the end of week 5 or early in week 6. 4. Limb buds. By week 7, small limb buds appear, which will develop into arms and legs. 5. Organ formation. By week 8, most major organs and bodily systems have begun to develop. The embryo is now about the size of a kidney bean. Weeks 9 to 12, fetal stage. 1. Transition to fetal stage. At the end of week 8, the embryo is now referred to as a fetus. The fetal stage is characterized by the continued growth and maturation of structures that have already been formed. 2. Facial features and limbs. The face becomes more recognizable with the formation of the eyes, ears, nose, and mouth. Fingers and toes start to become distinct. 3. Organ maturation. Although the organs are formed, they continue to mature and start to function. The kidneys begin to produce urine, and the liver starts to produce bile. 4. Sexual differentiation. The external genitalia begin to form and differentiate into male or female structures, although they are not yet distinct enough for a definitive determination of sex. 5. Movement. By the end of the first trimester, the fetus starts to make small movements, although these are not yet felt by the mother. Throughout the first trimester, the developing baby is highly sensitive to external influences, and proper maternal health and nutrition are crucial for the baby's development. This stage sets the foundation for the baby's growth and development in the following trimesters.